Okay, let's unpack this. Imagine something really, really tough to beat. An infection deep within your bone.
Hmm.
Not just on the surface, but right in the hard tissue.
Yeah, and what makes it worse is when the standard stuff, the surgery, the antibiotics, just doesn't clear it up.
Exactly. That incredibly frustrating situation, well, that's what our sources are diving into today. It's called chronic refractory osteomyelitis.
That sounds like a mouthful. Let's
Right.
break it down. Osteomyelitis, that's the bone infection.
Right.
Chronic means it's been hanging around for a while.
And refractory, what does that mean here?
Refractory is key. It basically means stubborn, resistant to the usual treatment.
So the sources say this is an infection that hasn't really gotten better after, what, maybe 30 days, 4 to 6 weeks of good surgery and the right antibiotics.
That's the idea. It's the infection that just, well, digs in its heels.
And that's our mission for this deep dive then. We've looked at sources exploring this specific challenge.
We have. And they discuss adding something else to the fight, an adjunctive treatment. And this is for you listening, maybe you're dealing with this or helping someone who is, or maybe you're just curious about these complex medical puzzles.
Okay, so what is this extra tool the sources are talking about?
It's called hyperbaric oxygen therapy. And the sources are really clear, it's adjunctive.
Meaning it's used with standard care, not instead of it?
Precisely.
Mm.
Picture this. You go into a special chamber. The pressure inside goes up quite a bit, actually, and you breathe pure oxygen.
Huh, like a deep sea dive, but with oxygen.
Sort of, yeah. It creates this unique environment inside your body.
So how does that actually help with a bone infection? What's the science bit?
Well, the core problem often in infected or damaged bone is a lack of oxygen. It's called hypoxia.
Okay.
Think of your immune cells like tiny soldiers. They need oxygen to fight effectively. Same for your bone cells trying to heal. They're starved.
Ah, so the high pressure and pure oxygen, it forces more oxygen into the blood.
Exactly. Much more than you could ever get just breathing normal air. It dissolves right into the plasma.
So the super-oxygenated blood can reach those damaged, infected bone areas that weren't getting enough before.
That's the goal. It gives those immune cells that oxygen boost they desperately need to take on the bacteria.
Does it do anything else?
The sources suggest it might. It could help certain antibiotics work better, maybe reduce swelling, even encourage new blood vessels to grow into the area, which also helps healing.
Right, bringing more supplies to the battlefield, so to speak.
You got it. Tackling it from a few different angles.
Okay, so if the standard surgery and antibiotics aren't working, when do doctors actually consider this?
It's mainly for those refractory cases, like I said, when the first lines of attack have failed.
Patient selection must be important then.
Very. The sources suggest it seems most helpful when the infection is quite extensive in the bone, or if the patient's general health is poor, or the tissue around the bone is compromised, poor circulation, previous radiation, that kind of thing.
Are there times it might be used sooner?
Yes, the sources do mention some exceptions. Think high-risk areas, infections in the spine, or the skull, the sternum, or in kids.
Because the consequences there are so severe.
Exactly. So in those cases, a trial of hyperbaric oxygen with antibiotics might be considered earlier, maybe even avoiding some really major surgery.
Okay, what does the actual treatment feel like according to the sources, a typical session?
Usually it's once a day, maybe 5 to 7 days a week. Each session lasts about 90 to 120 minutes.
And the pressure.
Pretty significant, often around 2.4, maybe 2.5 times normal atmospheric pressure. That pressure is crucial for dissolving all that extra oxygen.
And how long does the whole course of treatment take?
It varies, but the sources often mention maybe 20 to 40 sessions being common, sometimes more, maybe up to 60, depending on how things are going.
And timing matters too, you said.
Definitely. The best results seem to come when it started pretty soon after the surgical debridement, that's the cleanup surgery, and run alongside the right antibiotics chosen based on what bacteria they find.
The big question then, does it actually work? What's the evidence say?
Well, the sources review a mix of studies, animal models, human case series, some trials. They do acknowledge the quality of evidence varies, which is common in complex areas like this.
But overall,
Overall, the picture suggests that adding hyperbaric oxygen to surgery and antibiotics works better for these stubborn infections than just surgery and antibiotics alone.
better by how much? Are there numbers?
The sources suggest potential cure rates could get up towards, say, 80 or even 90% with the combined therapy, compared to maybe 70 to 80% for standard care by itself in these difficult cases.
That's a noticeable difference.
It is. And they highlight really strong evidence for its use in refractory osteomyelitis linked to diabetic foot ulcers. They call it a class 1 intervention there.
Meaning the evidence is pretty solid for that specific situation.
Yes. And it also seems quite beneficial for those tricky locations, spine, skull, sternum. Sometimes it helps avoid removing surgical hardware or means less drastic surgery is needed.
Okay, what about the downsides? Safety, cost.
Safety-wise, the sources generally indicate it's well tolerated. The main side effects are usually temporary things related to the pressure changes like ear or sinus discomfort, sort of like on an airplane.
Manageable stuff usually.
Right. And sometimes temporary changes in vision, which typically resolve after the treatment course ends. Serious complications are rare when protocols are followed.
And the cost. It sounds like it might be expensive.
Well, the therapy itself does have a cost, yes. But the interesting point raised in the sources is about the overall cost.
Oh, the bigger picture.
Exactly. If it helps heal an infection that wasn't healing otherwise, it could potentially reduce total healthcare costs. Think fewer repeated surgeries, maybe shorter hospital stays, less time in intensive care, maybe even shorter courses of expensive antibiotics.
That makes sense. Avoiding complications and repeat procedures saves money in the long run.
That's the argument presented.
Okay, so let's try and wrap this up. Based on the sources we looked at, hyperbaric oxygen therapy, when used with surgery and antibiotics, seems like a really promising tool for these chronic, stubborn bone infections.
Yeah, especially in those really difficult cases or when the patient has other health issues, making healing harder. It's an adjunct, an add-on that can make a real difference.
It really highlights how sometimes, for the toughest medical problems, combining different approaches is the key, isn't it?
Absolutely. It leaves you thinking, doesn't it? About how finding that right combination of therapies tailored for each person is so crucial for tackling conditions that just don't respond to one single magic bullet. It's about synergy.